Hello, this is Corey from the First Aid Training Co-operative, and today we've got a video showing you how we would do adult CPR. In an urban environment, if you have an adult collapsed and not breathing, statistics would say the reason they're lying on the ground is because of something called a cardiac arrest. So what we're going to demonstrate for you now is cardiac arrest CPR. So if I come into the room, there's a casualty lying on the floor. First thing I would do is stop and assess for danger to make sure the area was safe. I'll be thinking about cross-contamination issues and put my gloves on if I had them. If I wasn't expecting the casualty, I might not have gloves with me. I'm going to approach the casualty. I'm going to check to see if they are alert. Hello, can you hear me? My name is Corey, I'm a first aider. Can you hear me? Are you okay? Can you open your eyes and put my hands on your shoulders? Can you feel this? There's no response. So now we need to shout for help. Help! Is anyone there? Can I have some help? We're going to check the casualty's airway. We're just going to tilt the head back, open the mouth and lift the chin. And I'm going to check for breathing for up to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The casualty is not breathing. What I need to do now is make an emergency services call. So I'm going to use my phone, I'm going to dial 999 and I'm going to ask for an ambulance. I need to tell them where I am and I need to tell them that I have an unresponsive, non-breathing casualty. If there is anyone around, unfortunately for me today no one has arrived, but if there was someone else here, I would let them make that emergency services phone call and I would ask them if there was a defibrillator we could use in the building. Because there's no one else here, I've done my emergency services call. I can put my phone down and I need to start my CPR. So we start CPR with chest compressions. So I'm going to put my hands in the center of the casualty's chest and I'm going to interlock my fingers, keeping my arms straight. I'm going to put my shoulders over my hands and I'm going to do 30 deep compressions, 5 to 6 centimeters deep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Once I've done my first set of compressions, I'm going to give 2 rescue breaths to the casualty. So I need to tilt the casualty's head back, I need to open their airway with a chin lift, I also need to pinch their nose, and I'm going to breathe into the casualty's mouth and I'm going to watch for a chest rise. Let the air out. And give them a second breath for a second. I go straight back into 30 compressions. And I'm continuously going to do 30 compressions and 2 breaths until help the emergency services arrive and they can take over. This could take quite a while and I'm just going to continue as long as I can. So I'm going to stop for the demonstration, but if this was a real situation, I would continue with my CPR, 30 compressions to 2 breaths for as long as I could. So just to conclude our adult cardiac arrest CPR, as soon as we realise there's been an accident, we're going to stop, assess for danger, make the scene safe. We're going to check to see if the casualty is alert. If they're not alert, we need to shout for help. We need to open the casualty's airway, head tilt, chin lift, and check to see if they're breathing for up to 10 seconds. If the casualty's not breathing after 10 seconds, I'm going to phone the emergency services, dial 999. Once I've made the emergency services call, I need to start my CPR. And we'll start with chest compressions. So we do 30 compressions at a depth of 5 to 6 centimeters and a speed of 100 to 120 per minute. Once I've done my first 30 compressions, I'm going to do 2 breaths and then continuously 30 compressions to 2 breaths until help arrives.